Welcome back to another episode of Beyond the Tube. Today, we are joined by the lovely Kate Broderick, who is an occupational therapist and speech therapist. I don't want you to think, oh, great, this is just another therapist joining us today. She is an incredible therapist. However, not only does she have clinical experience, she's also a mum who has lived experience with a tubie kid. She has a professional stance and also a personal viewpoint on tubie kids and how sensory processing actually really affects our tubie kids. Thank you to Kate for joining us today. Really appreciate your time.
Well, thank you so much for having me. It's a fantastic topic, a wonderful community to be part of, and I'm really delighted to be able to chat further and hopefully help some other parents and caregivers feel a little bit more connected and empowered as they are probably just trying to understand their kids. And I think about advocacy a lot as well, and sort of
Yes.
feel more confident in trusting their gut is a big point of mine often.
Absolutely. Yeah, no, I agree. I think advocacy is a great word. We tend to use it a lot on this podcast because advocating for yourself and for your kid can be something that is easier said than done. If you can learn those tools and understand a little bit more about what's going on in your child's mind or what's going on in their bodies, it helps you to be able to stand up and advocate.
Yeah, definitely.
Tell us a little bit about you.
Starting with the professional piece, trained first as an occupational therapist. And I often speak about the fact that my early clinical practice and training was quite bread and butter. Of course, I learned about sensory processing, and I'm happy to chat through what I would call the basics today, because I think it's always a good place to start. But definitely my lens has evolved a lot as I have matured both as a professional and, as you mentioned, as a parent.
Yes.
Becoming a speech pathologist, I got a lot of training around the orofacial complex and understood better the nuances of some of the things that were happening internal to the mouth. And certainly with feeding, getting more of an understanding of things like reflux and the function of the stomach and all of those bits and pieces. So that was quite helpful. But as I often say, even having all that experience, nothing quite prepares you for the journey that you'll have with your own child. I've got 4 children.
Yeah.
I'm actually pregnant with my fifth right now.
Congratulations.
Thank you. So who knows where my journey will land. When my baby arrived as a very low birth weight baby, which was a surprise to everybody, I had an emergency cesarean. The first words out of the pediatrician's mouth were, "This is a very little baby. You two won't be going home together." And they whisked her away. I didn't sit there feeling sad or stressed. I was very
Mm.
brave in a sense, objectively. And
Yeah.
I was just like, yes, whatever you need to do. And also, I'm a professional. I can handle this. I trust other professionals. I'm not going to sit down and sort of focus on the fact that I wish I had some skin on skin contact or, all of those other things. Seeing my child grow up as well and
Mm.
seeing the cascade of other revelations around her neurotype and all of those things. Humans are complex, and
Mhm.
sensory processing is one major way we experience the world. I consider myself to be what I call a trauma informed clinician, which means I just think very broadly about the nervous system and whether or not it is feeling safe. We often call that being in a parasympathetic dominant state or a rest digest, interestingly enough,
Yes, yes.
connect
Very
and learn
appropriate.
state, or whether or not we're in a sympathetic dominant state, which is fight, flight, freeze, and fawn. Sensory processing is one huge piece that we can use to both
Mhm.
understand challenges and overwhelm,
Yeah.
but also to support more safety in the nervous system, that relationship based consideration. So, connection with primary caregivers and secure attachment and co regulation, which is where you bring your safe nervous system to another person's nervous system, which for many of us occurs through physical touch and through routine things like me sharing a meal, breastfeeding, bottle feeding, holding, touching, sitting down together. All
Mhm.
of those things sit within a bigger picture of our entire nervous system. Things that we might talk about today. I'll
Mhm.
probably throw around this idea of what's trauma informed. It's not talking about necessarily things that have happened to you or bad experiences,
Yes,
but we know with tubie kids there probably are actual things.
definitely.
At the end of the day, how's your kid's nervous system going? What can we
Mhm.
do to make it feel safer? What's making it feel unsafe? Probably something in the sensory realm. And how can I manage that? And then also, is there anything in the sensory realm that can also help me in this situation, make my child's nervous system feel safer? I'm using these hand gestures as I talk of like zooming in and zooming out.
Yeah. Well, that makes sense. Yeah.
Understanding that the sensory piece fits within this big picture for me of just your whole nervous system safety and baseline.
That's amazing. So, in our tubie kids,
Yes.
how do sensory processing difficulties show up?
I think one of the learnings, in a sense, that I've had, and I've talked already about the nervous system and those sorts of
Mhm.
things, is
Mhm.
understanding that a lot of kids who have a different nervous system, when we're first
Yeah.
born or when we're just growing in utero, we're just sensory motor beings. Even when we're just bumping around in that swimming pool of amniotic fluid, and from 8 weeks of gestation, babies are swallowing. And they're,
Yes.
the size of a pea, and yet there's already this movement of the tongue happening, which is stroking pretty much directly on the brain and the
Mm.
nervous system. The way our orofacial complex is functioning, even in those early stages, shapes our whole nervous system development and our physical development. We have genetic code things as well. The nervous system and the musculoskeletal system that we have is connected to all of this. So when we have a kid who becomes a tubie kid, there's
Mhm.
already things that have been putting them on a certain trajectory before they're even born. When they might arrive early, for example, and an NG tube could be what is something that they experience.
Yes.
The reason they may have had or something that's part of just the constellation of understanding your why is that they already have a different nervous system and maybe lower muscle tone and a different reflex patterns and all of those sorts of things. There's a lot of an innate part. And then what we have is the interventions that are essential and often life
Yeah.
saving and necessary are quite traumatic for our nervous systems as well. They don't align with what would happen in nature. And that
Mhm.
is across multiple sensory systems.
Yes.
We have, when we talk about sensory processing, this sort of model where we say we've got 8 senses. We have 5 which are outward facing. That's our sight, auditory, our hearing, our taste, touch, and smell. Then we have 3 internal senses. One of those is vestibular, so that's to do with movement. One of them is proprioception, which is to do with like almost pressure senses. So if you give a baby a hug or if they're moving or jumping, they get proprioceptive input. And then the other is interoception. That's our ability to register and process and organize the sensations from inside our body. Very much starts with, am I hungry or thirsty? Am I hot or cold? Do I need to go to the toilet? And in older kids, how am I feeling as well? That's a more advanced interoceptive or deeply connected to interoceptive
Thing.
awareness, sort of developmental skill that we see a lot of older kids where we have goals like emotional regulation. But if we
Mm.
tie right back, we'll often realize, wow, this kid's got challenges with feeding and detecting their hunger cues and toileting urges, and they don't tend to wear clothing that seems aligned with the weather. And there's lots of stuff going on with their interoceptive awareness. When you are putting a tube into a baby, there's a lot of physical sensory input. And then also we're feeding them and there are things happening in the stomach and
Yeah.
um, their needs are not always going to be necessarily met in a way that feels directly related to what their nervous system is telling us that they might need. Babies obviously don't have access to verbal speech yet. You can't self advocate. But really, in an ideal world, if a baby turns their head away or cries as we're trying to do something to their face, we would be
Mhm.
responsive to that and stop. But that's
Yes.
not what happens for these kids. And
No.
then we know that we need to get their calories up and we're putting the calories in so their stomach is feeling more full. And all of those things are being done on well managed medical schedules, but that might not align with natural body cues. Tubie kids definitely have very different baseline starting points with their nervous system, but different developmental and environmental experiences. That means that we can expect to see differences in sensory
Okay.
processing long term.
So, with the sensory processing, I suppose it's maybe a two-pronged question. How could I, as a parent,
Mhm.
or you as a professional,
Yeah.
identify if it's medical trauma or is it just a sensory processing issue? Is there a way to differentiate?
I would say no. I would say my belief is that you probably can't.
Yes.
If you have a child who is needing support, if they're a tubie kid, they probably do have, as I've said, a different nervous system. Word I also like to use that I think explains things quite nicely is this idea of complexity and neurocomplexity. It's not just limited to, the brain and spinal column and sensory messages go in and motor plans come out. It's actually in your physical body as well. A lot of these kids do have differences in their physical body. They may have physical disabilities, syndromes, and things that are structurally different in terms of their actual skeleton, not just, the soft tissues of the body, all of that sort of stuff. It's absolutely all connected, the way the body is operating mechanically and the way it is processing and receiving sensory information. So it's always going to be both, I would say. I wouldn't think that, oh, they're only sensitive just because they've been through this procedure, because there's the stuff that led to the procedure needing to happen in the first place.
Yes, okay, that makes sense. And as you were talking about that before, I was starting to connect that myself. And I think previous to this conversation, I thought they were siloed. I didn't think they were connected.
It's really hard. I feel as though gastroenterologists or pediatricians of the past were a bit dismissive and like, oh no, this is just behavioral. But now I'm hearing that there can be more of a shift where a pediatrician might say they are looking distressed with this, but I also suspect that they might have a neurodivergent identity or a different
Yes.
neurotype. They might be autistic, they might have sensory processing disorder. But sometimes
Hmm.
that also feels a bit stressful. I'm noticing with parents too, because they're like, no, not. They're like, no, no, but they've been through all this. How could they
That's right.
possibly be autistic? I don't think so.
That's a really good point. And I've had a conversation with other parents
Mm,
who have had these conversations with their pediatricians, myself included,
mhm,
where the first step is, well, let's get them assessed for autism and
mhm.
see if they are neurodivergent. And that's fine.
Yes.
And I think most parents are like, that's fine. We're happy to take them through the testing process. However, how do you identify what could be classified as a neurodivergent trait versus what is happening because they've been through extensive amounts of medical trauma? I think there's not much understanding between what could be one versus what could be the other, and how are they linked or are they siloed? Is it like, well, I think that, Ezra behaves this way. He behaves a certain way when he's calorie deficit. When he has not had enough, the deficit in his calorie intake changes his behavior.
Mhm.
So when he is being fed regularly, and at the moment we are not feeding him through the day, we are only feeding him overnight. If we don't hook him up to the tube feed overnight, if he doesn't get those nutrients that he needs overnight, it's not an immediate thing. I find it's a day or two later, you
Mhm.
will see that behavioral shift. He is incredibly moody. He's incredibly sensitive. Everything triggers a meltdown. If you walked in on that day, you'd probably think, I think Ezra's probably neurodivergent. I think
Yes.
that's what's happening. But I think if you saw him today, when he's really quite well regulated, it takes a lot more to push him to those limits. His limits are pushed out a lot more. It's not a day where we're, fighting to feed him through the tube, or he's not having a tube change or something that's medically stressing him. It's just a normal day and his calorie needs are being met. He's a very different child.
Yeah. Thank you for sharing all of that as well, because
Yeah.
that echoes a lot of what my clients will tell me also.
Interesting. That is so interesting to me.
It's hard because I think also a lot of people have, and whether or not that's because you're dealing with a lot of other things as a parent of a kid with medical complexities, or whether or not you're a person out there who actually doesn't really have to think about this in your life. When we're talking about, say, autism, for me, I'm a very, I guess, modern, I would say, um, definitely
I love that.
neuroaffirming clinician who has been through, as an OT. I'm a speech pathologist. I'm trained in the ADOS. I've been working with those populations for 20 years, and I used to be very proud of my diagnostic capacity, which was very deficit based, and would describe the things that I saw that really, really focused on, for example, restrictive and repetitive behaviors and overwhelm and certain, I can't even almost say it anymore, like, like different social, like styles and communication styles and all of that sort of thing. I very much see autism as often just a more sensitive nervous system with a unique way of processing information. A lot of autistic people are what we call Gestalt language processors and Gestalt thinkers. The way that just shows up is through increased sensitivity, and certainly not always a challenge or a vulnerability, it doesn't always provide barriers in life. In fact, I think it can often be autistic traits that are so positive that can be the thing that more old school clinicians will say, oh, they can't possibly be. Look how, social they are. Look how empathetic they are. Look how bright they are. Look how, and I'm like,
Yes.
those are all the things that are actually making me curious about this neurotype as opposed to the deficit-based trait. It's really, really tricky. But if you are a parent who's having those conversations with a clinician, maybe a bit of advice would be think about your medical professional and whether or not they might be more in that medical model or perhaps more in
Hmm.
a neuroaffirming model. I think a neurodiversity affirming developmental pediatrician, they will be probably trauma informed in their understanding. And if they're seeing strengths as well as challenges, they will be
Hmm.
able to sew the big picture together. A lot of the kids who I see who are tubie kids will have developmental differences, even if they're not specified by a syndrome or whatever, definite low
Hmm.
muscle tone. Low muscle tone as being an expression of neurodivergence. And it is
Hmm.
very common in autistic people. Again, not always. Sometimes we see a further end of the spectrum or the opposite end of the spectrum with high muscle
True.
tone. That's why we have all these autistic Olympians that you are sitting at the extreme pointy ends of the bell curve.
Yes.
Um, so winding back to the what was my birth story, when I hear that we were born in a, very like high risk or when we were preemies, that
Hmm.
does tell us about a child's nervous system. It also tells us about the parent's nervous system. Most
True.
autistic kids' parents are also autistic. They might not have
Yeah.
awareness of that.
Yeah, but it's usually how it comes from somewhere, doesn't it?
Yeah, so the reflexes that get the baby out or trigger that sooner, and the muscle tone that's in the uterus and in the infant themselves will impact the transit of the baby out. And if you get stuck and you have an emergency traumatic birth or one of those 100-hour labors, that already tells us that you are probably, yeah, a child with a different nervous system who has those genuine sensory processing differences.
Hmm. That makes
Yeah.
sense. I would like to know, specifically with our tubie kids, in practical terms,
Mm.
is sensory regulation different for a tubie kid than it is for everybody else? I
I
also selfishly want to know the answer to this.
Look, I think that in a sense, there are certain foundational principles of we're all human and we receive information from the world and that then gets, organized. That's our experience of the world. And then that will shape the behavior, the way we communicate, learn, move, whatever it might be.
Less of a negative sensory experiences. I find with Ezra, in comparison to, again, other tube kids
Mm,
that I know of
yeah.
that are quite comfortable with tube changes, for example, Ezra will not let us check the balloon. We have to do it like in the middle of the night when he's totally zonked out because he's just so distressed by it.
Mhm.
He gets his button changed at the hospital so that we can keep the trauma at the hospital and not have the trauma in the home, which was an intentional and deliberate choice by us in conjunction with him. We talked to him about it. He was much more comfortable doing it there. So that's what we do, which is good for them as well because they can then obviously use that time to train other nurses and other doctors in what to do. So it works mutually beneficial for all parties. But I actually had a conversation with him last night because he said to me, my button feels loose.
Um,
And I said, well, you might need your balloon checked. And we had a really big conversation around how does the balloon work? Why do you put the syringe in to withdraw the water and then putting the water back in, which inflates the balloon and holds it in place and stops it from falling out? And he asked so many questions. And then this morning came to me and said, Mum, it's fine. It's not loose anymore. I said, I didn't check it though. I think it's probably still loose. It might just be because you haven't eaten or you need to go to the toilet or, like something could have changed it. So he's very aware,
mm.
but when it actually comes to checking the balloon or changing the button, it very much distresses him. We have to hold him down. It's super traumatic for everybody involved. It's not just him. It would be worse for him because he is the patient in that scenario, but it's very traumatic for everybody.
Yeah, and I think that there are all of those true factors regarding what your body has experienced, but also emotionally and cognitively around his sense of autonomy in that situation.
Mhm.
And I guess the factors that I would often sort of encourage people to think about the most when we want to support kids is, again, being in the care or deeply connected with somebody with whom they experience secure attachment, which is usually you.
Mm.
But sometimes that's not going to be enough. And you have to wonder, if I do this procedure, am I going to really damage my parent child relationship and his sense of security and safety with me? So,
Yes.
is that plan, which I think it probably sounds like it is in your case, that you've made to keep it in the hospital and keep it with other professionals, actually holistically the most trauma informed approach for him.
Yes. Yes.
And when I just talk to parents generally about behavior and all the things that we can do that can creep quite casually into our parenting, for
Mhm.
example, raising our voice and sometimes, as you say, holding kids or
Yeah.
even like basically making threats, which sounds like a harsh word, but come on, like if you get this done, then I'll give, or bright, positive reinforcement, and then you can have a chocolate later or whatever, or a threat of abandonment. Like if you don't hurry up, I'm going to have to go and I'll leave you here and the doctor will do
Yes,
it
and I'll
anyway.
leave you. Yeah.
All of that sort of stuff is what we want to avoid. Sometimes as parents, you got to do what you got to do, thinking about our own mental health and our own experience as parents. It's like, how do you live with yourself? You live with yourself because you understand what you're
That's right.
aiming for and what you want to be doing most of the time. And
Yes.
then have clarity when you're not doing that as to why. And you sort of live with that. Um,
Yeah, I agree. How do you think sensory tools play a part in every day when children are coping with these things? So, for us, when Ezra goes in for a tube change, we always take his iPad with him
Mhm.
to try and use that as a distraction by putting something, on for him to watch. He 9% of the time doesn't work, but we still do it. He brings his favorite toy with him of the moment. So he'll take something with him. And those are kind of the two things that we do. But is it
Absolutely.
something
I would not
encouraged?
deny a child, whenever I'm setting a goal, again, for any child in any setting with any profile, my criteria for that is when given unlimited access to their regulation tools and when they have access to a safe and trusted caregiver, so and so will be able to do whatever it is we're hoping. And
Yes,
if you don't meet those first two parts of that line, it's game over, or it's,
that's right.
all bets are off. Sorry, don't put demands on this child if you are withholding things that
That's
they
so
need
true.
for their nervous system to feel safe. I would say, yes, I'd be really advocating as a parent to make sure a child can have access to whatever it is they think that they need and want in that situation, letting them know that they have unlimited access is protective. Thinking about my own kids at school, as soon as they think that they're not going to be allowed to go and have a walk when they need one or hold a little fidget in their hand, it breaks down trust between them and their teacher, for example. They already start to panic. And as soon as you say, oh, sure, you just have whatever you want, half the time they don't even need to use it.
Yeah, that's
They
right.
just feel
It's
so
just that
validated.
freedom of being able to access it if they need it.
iPads are really high impact. They don't even always work because that's showing us the magnitude of overwhelm. So I wouldn't hold any guilt in that as a parent. I would say prioritize big picture, what's going to keep your child's nervous system feeling as safe as possible and just go for it.
Yeah,
Um,
okay. That's good, that's good. And what do you think look, I imagine most of our parents listening and caregivers
mm,
listening have got kids that are in occupational therapy and speech therapy and probably a multitude of other therapies as
yeah.
well. But specifically for occupational therapists and speechies, those two together, what role do they play in supporting feeding therapy and, sensitivities and all of those kinds of things?
Occupational therapists are about understanding or supporting you to explore and understand, and supporting your child to understand their own sensory profile. Once you can start making progress with that, that will set them up for self advocacy, because otherwise we are just having a stab in the dark at what's going to work for them.
Mhm.
And as I mentioned before, there's not any fail safe thing that we can just prescribe. So one day taking a poppet with you might be regulating, and it might be nothing that's going to, that it might not be
Yes.
helpful at all the next day. So
Yes. Yeah,
thinking about
definitely.
options and toolkits and being really flexible and adaptive. And I think that OTs should be supporting kids in sort of understanding that the way they feel is
Mhm.
dynamic and it's going to fluctuate. It's almost like emotion coaching or interoceptive awareness coaching. Like, what are you feeling today? What would be helpful? And coaching them towards autonomy, getting their input as much as possible. And if they throw out something that you think, oh, that sounds ridiculous or silly, or as if holding onto that straw that you picked up at Macca's last night's going to make you feel better in your appointment tomorrow, don't go there. Be like, sure, do you want to get two? And I'll put it
Yeah,
there
that's
in my handbag and just, follow their lead essentially as well. And that's the skill, depending on how long your, child is a tubie kid for, as
yeah,
they, as
true.
they, develop their self-advocacy and ability to have input into requesting and recommending things for their
It gives
own.
them some control too, doesn't it? Like I find with Ezra, there's so much of his life that's been out of his control
Mhm.
that the things that he can control now, he's very controlling over. So if it is that, I want to hang on to that straw that I got from Macca's last night, then that straw is coming with us probably for a week. Like it's coming in the car, it's going to bed with him. You know what I mean? Because he actually is in control of that. So much of his life has been out of his control
Yeah. Yes.
and continues to be.
Yeah, and I think that's again, the unique to kid experience. As parents, we need to be really careful not to go down into a worry cycle of where they're going to be in 5 years, or as adults, like, oh my goodness, what if I
Yes.
let him just take whatever? Is he going to be walking around the world with a pocket full of no? Do not worry about that. We're focusing on the here and now, and certainly, I guess I think it popped into my mind and then escaped before I said it before with the medical procedures. We're not trying to build tolerance for that.
No,
We want
no.
to give them all the support in this moment. I definitely wouldn't be advocating for that. Returning to this question though, and the speech pathologist's role, although we're talking about feeding, I would again just link back to that theme of advocacy and self-advocacy and communication and making sure that even if a child has not got access to verbal speech, for example, and might not have an alternative system for communicating, then they need to have coaching for parents and caregivers and medical staff to be really attuned to the cues of that child regarding
Okay.
consent. Obviously,
Okay.
again, if we know something is happening, then it has to happen. But there's little regarding timing and the way things are done.
Mhm.
When you're an attuned caregiver, kids still communicate their consent for certain
Oh,
things. And again, you can still like presume competence and speak to the child and explain things, right the way through. It's never too early to start that. So that's sort of, I guess, handling the communication piece. But then when we look at actual feeding and orofacial function,
yes.
I really think that some therapists are very sensory based in their lens for feeding therapy, and some are very oral motor based. And I definitely have got a lot more training in that space because I'm into orofacial myofunctional therapy, and I think about breathing and oral rest posture and palate growth and potentially whether or not a child has a tongue tie. I feel as though some of the feeding therapists who are very sensory are quite dismissive of the motor piece,
Yep.
and
Yep, I
vice
would agree.
versa. I'm like, you
Yeah,
know what? Snipping a tongue tie or expanding your palate doesn't change the nervous system. That's not going to treat interoception.
true.
When you change structure, it doesn't mean that you're going to see shifts in form and then function. I do think it's about looking at each individual child and thinking about what's most dominant for them and
Mhm.
what their nervous system can handle as well. Kids who are complex medically, and I can see that they've got a very significant tongue tie, for example, with their tip,
Mhm.
pretty much welded to the base of their mouth. But I don't know that saying, "Oh, let's release that tongue right now," is actually the right choice for them because it's another medical trauma. And if
That's right.
they can't participate in what we would call exercises or, neuromuscular retraining to retrain the tongue to function better, we might actually cause more challenges. It's possible that you're, in the immediate future, if you have a different nervous system and you suddenly change a structure on a child and they don't know what to do when they've got their tongue sliding around in their mouth, might see that they start to snore or they start to
Mm.
gag more. If I have a child who's already got some feeding sensitivities or feeding challenges, if they're nutritionally stable, you need to be very careful about planning other medical intervention. A seasoned speech pathologist should be not running like a bull at a gate on those sorts of things, even though they are
Totally.
the go-to person.
Considered about what you're doing, don't necessarily have to put it into action.
It's so hard for parents as well because you are hopeful
Yes,
sometimes that there'll be a quick fix and you're worrying that your clinical team might be missing something. A lot of parents who I've worked with have said or heard me say, I'm noticing this. It is there. I don't want you to think it's been missed and I'm not going to forget about it, but that is not where we're going to be starting therapy.
that's right. Like you said, communication's a big thing.
Mm.
Knowing why you are doing something or why you're not doing something and being having that communicated to you can be a really big help when the fear of the unknown takes over.
Yeah, that's right. That's right.
Definitely helps. Before we wrap up, I wanted to ask you, what is your top advice for parents who are feeling overwhelmed by sensory challenges?
I would definitely validate your, I suppose, understanding that sensory processing is significant. It's a big part of what's going on. I would steer you towards thinking in that larger, wider lens of trauma informed. So thinking about their nervous system holistically and whether or not everything that you're doing in their life, so it's this sensory lifestyle, is supporting this safe nervous system state or more of a fight or flight or unsafe nervous system state. Again, even for kids who aren't having that extra layer of medical complexity with their tube, who have feeding sensitivities, something I often talk about is the fact that these children are facing sensory processing differences 24/7.
Yes.
And you're trying to give therapy strategies and recommendations that are often quite focused on meal times. Well, the nervous system doesn't just switch into a different mode then. A lot of the kids that we are supporting are starting very gently, are thinking about when would be a time where we would expect to see them in some sort of zone of safety so that they could develop and grow a bit better. Well, it's probably not going to be
Yeah.
while we're getting ready for school in the morning. It's probably not going to be
Probably
after
not.
school.
No.
It's probably not even gonna be for a dinner on a school night, and it might not be on a Sunday night, even though that's the weekend because 'cause we're going back to school tomorrow. So maybe it's on a Saturday, and
Yeah,
that's
that's
one
right.
day a week. It's not necessarily that your strategies and the things that you're doing are going to be an everyday thing, but everything you do with your child that is keeping their nervous system safe
Yes.
is actually supporting their feeding. That's what they are wired to do. Our brains want us to be able to breathe and eat and connect with other humans. So focusing on all of those things is important. If you have a team in place or if your child's at school, asking therapists to write reports is really helpful. It's clear communication and it's
Yep.
accountability. Talking about your child's sensory profile, the things that they might be more sensitive to, the things that they are less sensitive to, describing what you notice when your child is feeling overwhelmed. I guess just giving as much explicit instruction as you can to other caregivers so that they can be more attuned to your child's cues. And then again, recommendations of what might be a good response to that.
Great advice.
Yeah.
I think that's very practical. So we can provide that information to preschool or daycare or school or other caregivers. We know what triggers them. We know what helps to support them in most instances. Sometimes you just need to put it down in writing so that people can refer to that.
Absolutely. Like, I have many professionals involved in my own children's care. I don't write those reports for my kids, but there's a collaboration where my input, my voice, my observations are actually the leading perspective in that, as they should be because
Yes,
I'm a parent, not because I'm a professional and
that's
because I
right.
know my
You got to
child.
change a hat.
Yeah, that's right. That's very sage, broad spectrum advice, but just remembering as well that it's not just all of the taste and the oral motor stuff. Do think about the wider environment, like
Yeah,
the
expand it
number
out a
of
little
people
bit.
around, the noise, the smells. Is your child being fed next to the toilets where they can smell other things that, are they feeling alone? Is there a noisy air conditioner in the room? What type
Mhm.
of cutlery? I mean, my son said to me yesterday, "Oh, mum, why do they make spoons made out of wood?"
I agree. I think most of the planet agrees with that one.
And just listening to our kids when they say those things,
Yes.
translating it into documentation and
Mhm.
making sure that the actions and the environment that we set up for your unique child is
Yes.
really the best it can be based on what we've observed or what they've told us.
Do you wanna tell people what you've got available and what's coming up for you?
My therapy practice is spottherapyhub.com.au. So that's a pretty easy one to Google. I also have a training platform which is called Neuroway. So if you Google neuroway.com.au, you'll find a parents hub. We've also got a therapist hub and a support workers hub.
Amazing.
But definitely within the Parents and Carers Hub, there is already a webinar on sensory processing and one on feeding as well. My real passion now is to try and help more people and make information accessible. Follow along, as I say, Spot Therapy Hub, Neuroway. There'll be lots of things, both paid and unpaid, in a variety of in person and online formats that hopefully will be helpful.
That's amazing. Thank you, Kate. I really, really appreciate it. And you're right, creating more resources, having more accessible items available to people, whether that's paid or unpaid. I mean, this podcast is free to everybody or on YouTube for people to watch if they prefer visual, because it's the information that's out there is limited for our tube feeding community. The support out there is limited as well. And I don't think there's enough clinicians like yourself that have lived experiences. And that's not through fault of their own. We only know what we know, right? But it's very, very helpful in this community if you have an understanding of what it's like to have someone who has had a tube in their life. It's very helpful, and I'm very thankful that we have you in our tube feeding community and that you've got these fantastic resources available to everybody. So big thank you for joining us today on the podcast and continuing such great advocacy for the tube feeding community.
Hey, thank you so much. It's been an absolute pleasure. And I will thank you for the community back as well for having this podcast, which is, yeah, a phenomenal resource for the community. So, yeah, thank you
Thank
for
you. I really appreciate it.
having
Oh,
me.
of course. Kate and I can talk forever and we could keep talking about this very important subject for hours. But now you've got this podcast and you've also got Kate's amazing resources. We will link everything to the show notes so you can easily access everything. But once again, thank you, Kate, for joining us. And until the next time, stay safe and we'll see you soon.